I'm willing to risk sounding like a snake oil salesman when I talk about the ketogenic diet being likely effective for a range of psychiatric disorders, including schizophrenia, schizoaffective disorder, bipolar disorder, major depressive disorder, ADHD, anxiety, and more. We are currently in the beginning of the research, but we are seeing very promising results. But this is confusing to many people that have been within the mental health space and know about the DSM with the different diagnoses. And then each diagnosis would have its own specific treatment course and its own specific way of being handled. This is not necessarily the case when it comes to metabolic therapies, because what these therapies are doing, they are targeting likely the underlying factor that then leads to all of these different diagnoses. The same way that I always use the metaphor of a house. There's a house with different problems. So in one, let's say the bathroom is not working, in the other one, windows are broken. And the old approach would have been to go room by room, see which kind of symptoms and decide which kind of specific symptom control. So let's say in this case, we're going to fix the windows. In this case, we're going to fix the bathroom. And sounds about right. However, what if the foundation of this house is moldy, shaky? It doesn't sustain the structure of the house. So no matter how many things you may change in each room, you're going to have to chronically fix them because they're not going to resolve themselves. It isn't a one-time issue in which you just fix a window, because then the house is going to shake again and you're going to have broken windows and problems with heating and all of that. This is what's happening with metabolic therapies. We are finding some of the factors within the foundations of the neurochemistry of the house that is then leading to problems in different areas. So for one person, if the problem, let's say, is windows, so let's say that the problem is within the regulation of the mood within the brain and the energy production, this person may show with bipolar symptoms. If the area that is dysfunctioning, if that is the area that relays the information from sensory information to the brain, they may have psychotic symptoms. As you can see, this is why different diagnoses that are completely separate from each other has never worked, because a person can have dysfunction in different areas of the brain. It doesn't mean that if one has one disorder, then they're not going to have the other one. And so what we end up with is people that have a laundry list of symptoms, or they get switched from one diagnosis to the next each year that passes because they develop new symptoms. If the brain is malfunctioning as a whole, if it doesn't have enough energy to regulate mood, energy, thought processes, emotions, and